So in this video, I want to talk about immediate implants. An immediate implant is an implant which is placed at the same time as doing the extraction of the tooth. And the reason why we would do this is so that we can start the process of replacing a patient's lost tooth as quickly as possible. Now, if we're able to take the tooth out and there's sufficient bone in that area, and I can anchor that implant in with good stability at the same time, we can wait only about 4 more months and then the patient can start getting a tooth over there. Now, in the traditional way, a non-immediate implant, or what we call delayed implant placement, the way it used to work was we took the tooth out, we did some bone grafting or maybe no bone grafting, we let the socket heal for about 4 months. Then we went back and did a second surgery, which was placing of the dental implant. And then we waited another 4 months or so. And then the patient was finally ready after that to start getting a tooth on there. Now, with immediate dental implants, we can cut down the total time from extraction to having a replaced tooth down to about 4 to 5 months instead of 8 to 10 months. And that's obviously something the patient is really going to like, because now they can be without a tooth for a shorter amount of time. Now, patients will ask you, okay, so he's definitely going to be able to get that implant in the same day? The answer is maybe. We will obviously be taking a CT scan first to see exactly how much bone there is and what the socket exactly looks like. And then the final determination of whether we place that dental implant on the same day or we do an immediate dental implant is determined once the tooth actually comes out on the day of the surgery. So then I assess what the bone quality is, and if I can get a strong implant in there, great, I'll put it in. But if I can't get a strong implant in there and it's not going to be a good long-term successful implant, then we kind of revert back to the traditional model of doing dental implants. We'll bone graft the area, let it heal for about 4 months or so, and then come back and place the implant. So immediate dental implants are something which we're doing more and more of in our practice, and all oral surgeons and implant surgeons are. So that's something you really need to be able to explain well to the patient so that they understand the difference between the traditional way of doing dental implants and immediate dental implants. What are the advantages and what are the disadvantages? The disadvantages are really not there. The success of immediate dental implants, if done properly, are the same as doing it in the delayed fashion. And they only have to undergo 1 surgery with immediate dental implants. So that's a huge advantage that most patients like. In terms of the recovery after the initial surgery, it's about the same. If you're getting the tooth out, or if you're getting the tooth out and an implant placed at the same time, the recovery is going to be almost the same. The swelling is going to be the same, the pain is going to be the same, and so it really doesn't have any major disadvantages other than we may not be able to do it if the bone doesn't cooperate with us.